everyone, I am Simran, your host for the series of Newsmakers, the show where we bring to you tales of courage, resilience and persistence of inspirational people from all walks of life. Because at Newsmakers, we aspire to inspire you. My dear friends, today on the sets of Newsmakers, we are so proud because we bring to you a true hero from the field of medical sciences. He is a healer with a heart for hearts. He is a world-renowned cardiothoracic surgeon, heart and lung transplant surgeon, and he is also the founder, chairman, and chief of Cardiothoracic Surgeries and Institute of Heart and Lung Disease and Research Center. Please allow me to welcome Dr. Rahul Chandola on the sets of Newsmakers. Welcome to the set, sir.
Thank you.
We are so honored to have you here with us.
Thank you so much. I'm honored too.
So good, sir. I've been hearing and really, was watching your, I was just Googling about you and just wanting to know that you are such a renowned doctor. You've really healed a lot of people in the world, given lives to many. But coming here to this level in life, I'm sure it's not that easy. You must have had your share of struggles as well. And we would really want to know your journey so far.
Right. So I'm a cardiothoracic surgeon, and I'm specialized in all complex heart surgeries, lung operations, and heart and lung transplants. The journey, my journey essentially has been the journey of any other doctor in the country. It's a long journey, long training, as is for all the super specialists in the country. I trained in Banaras Hindu University. I did my MBBS and MS from there, and then I did my super specialist training, MCH, from Kanpur University. Then I was fortunate enough, that I got an opportunity to work at the world's leading heart institutions. I was there at Toronto General Hospital, Sunnybrook Hospital, and University of Alberta for almost 6.5 to 7 years. And that was the time where I got an opportunity to work with the world's best cardiac surgeons. I was fortunate. I got trained under Dr. Tyrone David, who is unanimously considered as #1 cardiac surgeon in the world. And there was so much of learning there, and I'm really thankful to God that I was always given an opportunity to learn so many things, to operate, and the faith that was bestowed on me by these bosses and these cardiac surgeons whom I worked with, and their legacy I'm carrying forward. While working there, I thought if we can do so well here, like in the West, why can't we take this to our country and develop programs here? And that was the reason I came back and started our heart and lung transplant program. I started my journey here in India in Chennai, where I was heading a heart and lung transplant program there. And then I thought, why not, because I belong to North, it's my hometown is very close to Delhi. I basically belong to Haridwar. So I thought, let's start a heart and lung transplant program up north. The problem was, in our country, the organ donation rates were quite dismal till some time ago. But gradually, the government is also taking a keen interest, and the cadaver organ donations are improving day by day. You'll be delighted to know that way back in 2009-10, the number of donations that were happening in Delhi were like 1 to 2 in a year. That's very dismal, right? But if you see now, we are seeing almost 15 to 20 donations in a month. That's a leap forward, and I hope these increased number of donations and the awareness amongst the people about the organ donation, this has changed so many lives. So many people are in the need of heart transplant, lung transplants, kidney transplants. All of these patients will be really helped by the increase in the awareness and the organ donation across our country.
That's wonderful, sir. This has been your journey, like here,
Right.
From where you started and you're here. That's amazing, sir. But then what was that one thing that made you to start this Institute of Heart and Lung Disease and Research Center?
Right. So I always thought, in our country, there is, because I am a specialist in heart and lungs, we do the most complex operations with regards to the heart and the lungs, right from a bypass operation to valve replacements, to all the complex aortic surgeries, heart transplants, lung transplants, the heart assist devices, we call them LVADs, So these are very ECMOs, these are very complex operations, but the problem is in our country, there are not any comprehensive programs where all of that can be done under one roof, and that's the reason we thought, why can't we have a program like that? These kind of programs are available in the West, but not in our country. So we thought, let's have a program like this where we can have, if somebody thinks about heart and lungs, be it a small problem or a large problem that requires complex operations like heart and lung transplants, that can be done all under one roof. People don't have to go to West or down South to get these operations done. And we've got a very amazing team. I'm very fortunate that we have got very amazing team. We've got very trained cardiothoracic surgeons, the thoracic surgeons, who do the VATs and robotic thoracic surgeries. We've got transplant pulmonologists, transplant cardiologists, and a very good rehabilitation team, And these people all of them have been extensively trained in India and abroad, and we've been able to have a very comprehensive program that can serve the society at large.
Superb. This sounds really great. I'm sure the viewers who are watching, they know where to just approach. Dr. Rahul Chandola is the person where you have to reach for a problem. I really say that, God forbid that you anyhow have this problem, but Dr. Rahul Chandola is there, the right person. So you see the times are such stressful times. And we also see that there are very young deaths happening, and especially because of heart diseases.
Right.
And most of it cardiac arrest. This is really heartbreaking to see that people, at such a young age losing life.
Right.
What could be the cause of that?
See, the thing is, as a cardiac surgeon, I can tell you, these were the problems that we didn't see probably 2 decades ago or 3 decades ago. Most of the people who were coming for heart operations used to be in their 60s, 70s. Some of them were like in late 50s. But now we are getting to operate on very young patients also. Right. Like day before yesterday, I had to operate on a patient who was just 31 years old, right? So you can imagine, why would a 31-year-old guy have a heart disease so extensive that he would need a bypass operation, right? And this is not a case in solitude. We often get these cases, every month we are doing, 3-4 cases who are as young as that, right? So what has happened is, many things have changed in the last 2 or 3 decades, Number one is our lifestyle, lifestyle has changed. We have become more sedentary, especially after COVID. People have started working from home. As a result, the activity has become limited, There have been a drastic shift in the diet that we take, right? So I remember, when we were kids, we never used to go to any restaurant. I never went to a restaurant with my parents, when I was a kid, right? And I think that's the story with most of our, most of the people who are in their 40s and 50s, right? But what has happened now is we've been going to the restaurant so frequently, right? All we are eating is that trans fat. Yes, times of Swiggy and Zomato, every day we are getting something from outside. We are eating all that unhealthy food, all that food is being cooked in, oil, which is, it's been utilized more than one time. So that oil is a trans fat, what we are eating is trans fat. What we are eating is the diet rich in calories, rich in very high carbohydrates, little protein, high carbohydrates, high trans fat, is what we are eating. All that junk food, all that processed food, that's all very unhealthy. So the diet has changed dramatically from what it was 2 or 3 decades ago. At the same time, all of us, be it a doctor, engineer, or somebody working in the corporate sector, all of us are under stress, right? people are running after targets. It's a target-driven job for everybody. As a result, everybody seems to be stressed out, right? So stress is also playing a big role in how our heart or vascular health is behaving. So as a result of all these things, there is increased atherogenesis in the vessels of the heart, and people are having these heart attacks, at a much earlier time as you would expect. The other thing is most of these heart attacks that are happening, they're happening between the ages of 40 and 50. You'll be surprised to know, 25% of the heart attacks occur at the age of, between 40 to 50 years of age, and 25% occur less than 40 years of age. This is really surprising, right? So, and that's been mainly because of all of these reasons that I enumerated, and lack of exercise is another important thing. People are not exercising enough. So I think way forward is we have to acquire a very healthy lifestyle. We have to realize that we are all prone to heart disease. And heart disease is something that can just take away your life from you, right? We have to realize that. So anybody who is above 40, we should always have a comprehensive cardiac checkup. We should get ourselves checked at least once every 3 years, beyond 40 years of age. And to know that, your cardiac health is good is extremely important to today's time, when people are having heart attacks at a very early age. Yeah.
So dear audience, now that you have noticed the cause of early deaths, all of us have to be very cautious. We have to see the kind of lifestyle that we are leading. Dr. Rahul has just told us that the sedentary lifestyle is killing very young people, and it's not the age to go. We have lots to do. Dr. Rahul, I would really be wanting to know that you see the current system in a medical system in India. We see that a lot of people who are wanting to get healed, but then there are inadequacies.
Right.
Do you see there is some scope of improvement here?
Yeah. See, we have to realize that we are sitting in the epidemic of heart and lung diseases today, right? The heart diseases are on the rise, lung diseases are on the rise. We are having such a burden of coronary artery disease. Yeah. We are having a burden of lung diseases. So many patients with COPD, so many patients with interstitial lung diseases, and chronic lung issues are there, right? Everybody in our family somewhere is suffering from some heart or lung ailment, right? So we have to realize that we are sitting right in the middle of the epidemic, and we have to realize that we have to act on it. Our medical system actually has improved a lot from what it was, probably a decade ago, 2 decades ago. Still, the problem is most of the medical system is with the private and the corporate sector right now, and that is largely unaffordable, to majority of our population. See, 80% of our population cannot afford these corporate and private hospitals.
Absolutely.
Yeah, and then they have to rely on the government hospitals. Government hospitals are not to a level where they could cater to such a large population, right? And the infrastructure and all that is also not up to mark in certain hospitals. Yeah, the government is doing its bit. Government is trying to get all these health insurances made available to everybody in the country. This is a great step ahead, and I think this is going to change the healthcare in our country. But if we want to make the health available to every citizen in the country, it is extremely important that we get everybody insured. Everybody's health should get insured. Even somebody is sitting in a village, not being able to earn anything, working on a daily wages, it's the duty of health insurance should be made available to everybody, because the cost of treatment is so high, exorbitantly high. Bypass operation for 3.5 lakhs or 4 lakhs, right? Even though it is very low if you compare that to the West, right? In the West, the same cost is roughly around $50,000, right? In our country, the heart surgery is being done at probably $3,500. which is just nothing if you compare that to the West, right?
Correct.
But still, even that cost becomes so exorbitantly high for majority of our population that it becomes an issue. So everybody in the country should have health insurance, and we should ensure that everybody is insured.
That's so wonderful, and I'm really crossing my fingers that our government system is watching this show, and I hope they work for it. That they're doing a lot already.
Right.
But do this a very simple and very small technique which is required for all of the people who are suffering just because they can't afford. Let's have everyone insured, because health is what wealth, and it is because if you are good, if you are healthy, it's for the world itself, for the country as well. So before we go, doctor, we had a lot of questions to ask you, because you are like an ocean of knowledge and you're doing so well. But we are constrained. We would like to ask you one super simple tip for all of us.
Right.
Like we would want to know that what kind of lifestyle we should have,
Right.
so that we are healed and living a happy, healthy life with a good heart.
Right. So as I said, a healthy lifestyle is the way to go.
Yes.
Yeah. If you realize that we have to eat healthy, we eat healthy in the sense that our diet should be low in carbohydrates, rich in proteins, rich in fruits and salads. That's all we need, in terms of food, right?
Right.
And we have to realize that eat when you're hungry, right? Not just because you want to fill yourself up, and eat when you're hungry. If you follow that, in terms of what you are eating, this is what is healthy. And then we have to ensure that we have to give at least 45 minutes to 1 hour to our body. We have to exercise daily, or at least 5 days in a week. You should give at least 45 minutes to 1 hour to your body. And the best thing to do is just to brisk walking. Yeah,
Yes.
Brisk walking is so good for the heart and for the cardiovascular health. Anybody who does 45 minutes of brisk walk, that's good enough. And the other thing is we have to do everything to keep the stress away. We don't have to take things very seriously. Think that life is short. We are here just to play our part.
Yes.
And we have to devise mechanisms. Each one of us knows what keeps us stress free, right? For somebody it could be getting involved with his hobbies, right? For some of us, it will be getting involved with their children, right? Playing with their children, having time with their family, right? Some of them, for some of us, it will be extremely important to go out on a vacation, spend some good time with the family, right? And for some, it will be like meditating, giving some time to yourself, meditate, do some art of living or vipassana, or whatever form that keeps you happy,
Yes.
keeps your mind relaxed. We should do that. And realizing that if you have any symptoms, symptoms in the sense that I'm talking about the cardiovascular health. If you have any symptom in form of chest pain or shortness of breath, or you have palpitations, you have syncope, all these are symptoms of some issue with the cardiovascular health. So if you have any symptoms, you should not hesitate. Just go and check yourself, get yourself checked. See a doctor, a specialist, a cardiac or a lung specialist. Get yourself checked. It's really simple. All you have to do is get a comprehensive cardiac checkup, and that will ensure that your cardiac health is safe and sound. Anybody who is more than 40 years of age, he should get at least once in 3 years. He should get a comprehensive cardiac checkup. For people who are younger but have a strong family history, or if they are diabetic, if they are having high blood pressure, if there's somebody in the family who has either died of heart disease or had a heart attack, at early age, these are the people who are high risk for cardiovascular disease, right? So even if they are 30 or 35, they should always seek help. They should always get themselves examined and ensure that they are free of any cardiac issues. Yeah.
Thank you so much, doctor. It was really insightful.